We're in Bisho Colony in the city of Chittagong in Bangladesh, and I'm here with some of the women from the community, along with the community health promoter, whose name is Fatina Begum. After 3 years of working exclusively in Dhaka, we had enough funding in 2009 to expand our work to the urban slums of Chittagong, which is Bangladesh's second largest city. There are 4 million people living here in Chittagong, and 30% of them have no access to water and sanitation. This is a city the size of Chicago, and there is no wastewater treatment plant. All the waste from the city flows into open waterways, and that's where people living in these communities are bathing and brushing their teeth and doing their laundry.
I was born here in this slum, and now I live here with my husband, who drives a rickshaw, and our 3 daughters. We are frequently sick from the dirty water. Last year, my husband couldn't work because he was sick with diarrhea. He stayed in the hospital for 10 days, and we had to pay 5,000 taka, about $70. That's a lot of money for us.
This is the dirty side of health in the slums. It's toilets, it's sanitation. So we're water first, but without the sanitation component, the water by itself is not enough. Prior to the installation of this toilet, people had no other choice but to defecate right out in the open or behind the building. And you can only imagine what that is like if you're trying to control the spread of disease. So children, animals, even adults can't help but step in it and bring it back into the house.
I first heard of the work of DSK when they came here, and they were meeting households and doing a census of the area. I helped guide them around the community, and I was very interested in the work that they were doing. I am educated, I can read and write, so I applied for this job. The first time I did a hygiene education session in a community, I was a little nervous, but now I've been working for 6 months, and I have a lot more confidence. My job is to teach my neighbors about the difference between unsafe water and safe water, the importance of using a hygienic toilet, and hand washing after they use the toilet, before making meals or eating, and other important times.
You know, the simple bar of soap is often overlooked in a lot of the water and sanitation efforts in the developing world. In any discussion of improved health, new gadgets, new technological advances will come up. But it's the toilet and soap that's usually missing from these technological innovations. Without all 3 components, water, sanitation, and hygiene, you don't see a lasting, measurable benefit in the community.
Most of my teaching is done in what we call courtyard sessions. I talk to my neighbors and find a convenient time where we can all sit down together. I use pictures to describe our environment. It's really important that I use pictures because most people cannot read, but they can remember the messages on the pictures. I really like my job. It's hard to call it a job because I enjoy it so much. My family is proud of what I'm doing, and I feel very good about doing something to improve the lives of people in my community.
I'm with Anwara Begum. We're in Kamranji Char, which is an area of Dhaka, and we're visiting her because she and her community took out a loan for a new water point and also a new toilet.
I was born here in Kamranji Char, and now I have 4 children, 3 daughters and a son, who all live with me. We've benefited a lot from having water and the toilet. My children and all the children living here are healthier, and so we notice that we don't have to visit the doctor very much, and we don't have to buy medicine to cure diarrhea. When we did the project, everybody in the community participated in hygiene education training, and we learned about things like hand washing after using the toilet and not bathing in the dirty Burganga River. My children know these things now.
I asked Anwara if she was nervous about taking out such a big loan for a water project, and she said that it was a big loan, but they really need water. And now, after 2 years, they completely paid back the loan 100%. And now that money has been reloaned out, it's been revolved, and there are other families in this area who are getting water and sanitation projects because she's paid back her loan.
Our neighborhood used to be a dirty place, but now that we have water and a toilet, everyone wants to live here. Our neighbors have seen what we've done here by taking out a loan and getting water and a toilet, and so a lot of them have asked DSK for help with their water and sanitation problems too.